Okay, here's an interesting cataract. This is a Brunescent cataract in a patient with a history of RK. You can see the radial keratotomy incisions with a little bit of Salzman type changes. I'm pretty careful as far as what type of lens to choose for this, go kind of in depth as far as whether they want to use a scleral lens or a hard contact lens after surgery. Knowing that an RGP or a scleral lens will be the best quality of vision that you could have afterward. If they're really trying to get out of there, then use glasses or get out of glasses. Then we can talk about using toric lenses, but all the measurements have to line up really nicely um, in order to do that. Otherwise, a light adjustable lens is a easy way to facilitate nice outcome as well. So doing an awful lot of chopping maneuvers here. I think this lens actually was denser than I kind of thought it was going to be. Um, but we're just kind of taking our time, getting some little fragments out, chopping them up, a lot of chops, and kind of making our way through. A lot of times, as you may know, the super brunescent cataracts have a leathery posterior plate, so getting a good crack really posterior kind of helps move things along. Um, and then in general, the RK patients, you gotta try to avoid the incisions so that they don't open up during surgery. But we're not really having any issue during this cataract surgery, just kind of taking our time through all the different chopping maneuvers. The lens that I like in aberrated corneas, whether it's keratoconus or post-RK or corneas with scars, is the B&L enVista platform, neutral spherical aberration. Just a really clean lens, easy to work with. And so it's kind of tends to be my go-to for aberrated corneas and post-hyperopic LASIK. So here our lens comes in. We use actually the Argos digital marker in the OR to line up the toric lenses. That's why you don't actually see any marks on the cornea. They're available through my operating microscope, the oculars, but they don't translate into the recording very well. So here we're just kind of lining it up right at its prescribed axis. And that's all she wrote as far as this surgery. So thanks a lot for watching. Hope it was a nice surgery video for you too. All right, take care.